certain foods and drinks can contribute to external tooth staining, creating darker discoloration on visible enamel surfaces. A dental professional first examines the discoloration to assess whether visible staining appears external or needs further evaluation. External pigments can collect on tooth surfaces and within tiny surface irregularities, making some areas appear darker over time. Professional cleaning may first remove accessible plaque and harden deposits that can contribute to a discolored appearance. Professional cleaning techniques may then help reduce removable external stains present on accessible tooth surfaces. Accessible spaces between teeth are also professionally cleaned, where surface stains and deposits can sometimes accumulate. Professional polishing may further reduce certain superficial stains and leave the clean tooth surfaces feeling smoother. Professional cleaning may reduce removable food-related surface stains, but results depend on the type and depth of discoloration. This video is for general education only. For tooth discoloration, please consult a qualified dental professional.